Hey guys, it's Dr. Braddock, and I want to talk to you for just a minute about ear infections. The reason that we're going to talk about ear infections is because, quite frankly, I'm a little disturbed at how many parents are dealing with chronic, recurrent ear infections. Their children are up, all times of the night. They're in chronic pain. They're constantly pulling at their ears. And parents, a lot of parents at least, are feeling a little bit confused about what they're supposed to be doing and is that really working. I want to tell you a different way to look at how to approach ear infections, because every time that a parent actually gets what chiropractic can do and how that could actually help a child with ear infections, they typically get pretty frustrated that no one had ever told them this before. So I'm not going to take much time, but I do want you to understand exactly what an ear infection is and the two different options that you have when it comes to treating it. Every person has a small tube that goes from the back of the ear to the back of the throat. Call that the eustachian tube. It's essentially a tube of muscle, and it's constantly pumping, right? And it's pumping the fluid from one place to the other. Now, in a child, before the face is fully developed, that tube is level, okay? So it doesn't have gravity to help it out. As we grow and mature, our face elongates as adults, and that tube comes down at an angle. And so even if the tube's not working properly, gravity will help keep that tube drained. And that's why adults don't have the same ear infection problems that children do. So, what controls that tube of muscle? The same thing, it controls all the function of the body, and that's the nervous system. Okay? There is a nerve that goes and controls that tube of muscle and makes sure that the tube is consistently pumping fluid back and forth. The problem is when the very top bone of the neck, the atlas, starts to misalign and rock one way or the other, it starts to pinch and choke that nerve, and it turns off the pump. So stop for a second. We're coming into summer. If you have a pool or know anything about a pool, if you had a swimming pool in the state of Texas in the summer, it gets really hot. If someone turned the pump off, what happens to the water? It gets green, right? It's going to stagnate and it's going to turn green. It's going to be full of algae. It's basically going to become an infected pool. And you've got two different options. Now, most people are going to go to the doctor and they're going to get an antibiotic. That's kind of the first course of treatment for an ear infection. That's like taking a giant bucket of shock or disinfectant and throwing in that green pool, right? You're going to get that pool blue. Right? It's going to kill the algae, it's going to disinfect the pool, and in a day or two or three later, you're going to have a beautiful blue pool. But if nobody ever actually goes and they turn the pump back on, what's going to happen in another week of the hot Texas sun? You have another green pool. How many parents, or maybe even you're a parent watching this, and you've had that ear infection, round of antibiotics, it gets better, ear infection comes back. Another round of antibiotics, ear infection comes back. Another round of antibiotics, schedule a tube surgery. Think about this for a minute. What does anti mean? Against. What does biotic mean? Life, right? So an antibiotic is against life. So you have to understand that when you give an antibiotic, it may actually kill the pathogen, the bad bug, but it's going to kill all of the good bugs, right? Know it or not, you have good bugs that are actually the natural flora of your body. That is where your immune system lives. And so you wipe that out. You consistently hit that child with antibiotics over and over and over. You are erasing their immune system. That's the child that somebody sneezes 3 doors down. That child's sick. Constantly turn around. It's bronchitis, right? It's upper respiratory. It's staph. It's strep. It's constantly getting all these infections when maybe some other kids in their class or other kids that you're around hardly ever get sick, and if they do, they recover like that. It's the difference in immune systems. Okay? So you consistently throw that bucket of shock in there and nobody ever actually turns on the pump. What we do is we do a very slight, gentle chiropractic adjustment. If you're watching this video and you know nothing about chiropractic, you're probably thinking like The Exorcist. When we adjust a child, particularly their atlas, it's about the same amount of pressure you would put on your own eyeball. It's the slightest pressure right here on the side, and it makes the biggest difference. Okay? If you are watching this video and you're anywhere near my office, I invite you to call, schedule an appointment, come in, we'll sit down and talk about how we can actually help your child get healthy. I have 2 children, glory be to God, but they are extremely healthy children. They've never been vaccinated or medicated, and we really want every parent to have that ability, to have a really healthy child and to be able to enjoy them rather than constantly having to go from one doctor appointment to the next, from one pharmacy to the next. It's not a very fun way to live. If you're watching this video and you live far, far away, that's fantastic. Find a chiropractor in your area. If you can't find one, call my office and we will help you find a chiropractor that can help your children live healthy. I look forward to seeing you soon. And last and most important of all, please share this. If you're watching it on Facebook, share it on your wall. If you know a parent that's struggling with ear infections, or their children are having problems, make sure you send this to them. Email it to them. I'll see you in your next visit. God bless.